Welcome everyone to the semi-finals of Indian Debating League. I'm Kamil. I'm going to be moderator for this room. This match is going to be between Karnataka versus Telangana, grade 7 to 9. So congratulations, you have reached till the semi-finals, and one of you will reach to the finals of Indian Debating League. Just before the match start, I'm going to introduce our adjudicator for the room, Aradham Belai from SLS Pune. Aradham is a winner and the best overall speaker at SRCC pre-ABP Parliamentary Debate 2022 this year. Also, he's an open breaking team at Monash Australians Debate 2020. Runner-up in grand finale, third highest breaking team, fifth best speaker at Trim 13th. Open semi-finalist, second highest breaking team on tab, DSNLU Parliamentary Debate 2022. And last, open grand finalist, highest breaking team, NLU British Parliamentary Debates. And obviously, there are so many achievements that the adjudicator have. With that, I'm going to come to the motion for today. So this house will not provide public health care to people who do not take preventive measures to keep themselves safe. Substance abuse, obesity, etc. Bit of info over there. So public healthcare is often thought of as a right, but rights come with the responsibilities. The fund allocation to the health sector this year was 83,000 crore, which is like 33% of India's GDP. And the population of the country is humongous. So this indicates limited beds, doctors, which we have seen in the case of COVID and all. So the it needs to prioritizing certain people, certain patient over other. So should we use this criteria to prioritize some people over others? That are they taking care in terms of preventive measures and speeches? All the main speeches, that the three speeches from both the side will be of 5 minutes each, and the reply speech will be of 2 minutes. Also, speakers can ask POIs in this main speeches, but not in the first speech and the last, not in the first minute and the last minute. Also, all the debaters, the 6 of you, please put your cameras on. Also, at sharp 5 minutes, the adjudicator will inform you that your time is over, then conclude within 15 seconds and don't add any argument after that. And last, that all the spectators, please have your camera off and also your mic off. Is that clear to everyone?
I had a doubt.
Yes, go ahead.
Are POIs allowed in reply speeches?
No. And the opponent goes first in the reply speech and the government goes. Is that clear? If that's clear to everyone, with that, I'm going to ask Ardham.
Hi, yes, thank you, Kamal. I'd like to invite all the teams and all the members to this debate. I will now, without further ado, ask the first affirmative speaker to open a case beside affirmative. Here.
Yes, I am. Hello.
Start on the count of 3, 2, 1.
Sorry, yes, you are audible. Sorry about that. I will mostly be interacting through the chat box, not to disturb the flow of the speakers. I will mention at the end, but even if the case of speech is over, I'll just type in the chat box that welcoming next speaker.
Yes. May I begin? May I begin, sir?
Yes.
Okay. 3, 2, 1. Greetings to the opposition party, the adjudicators, and spectators. I am Manishka Maveri, the proposition Prime Minister, and we'll be going for the motion. The House will not provide healthcare to people who do not take preventive measures to keep themselves safe. For starters, we need defining the two most important words here: public health. It is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choice of society, organizations, communities, and individuals. Preventive measures includes the measures or steps taken for prevention of disease as opposed to the disease treatment. It fosters improvement in adoption of the best practices, thus further improving outcomes. Preventive measures refer to all those actions taken by an individual responsibly and consciously to keep themselves and others around them healthy. And the productive this includes the activities that are legal, illegal, but not advisable, and those that goes against the basic duties of citizens of the state. Public health services focus on protecting and promoting the health of the entire population, whereas healthcare only, on the other hand, services focus on diagnosing and treating individual patients. They will have healthcare and will still be following the law. What do you mean by public healthcare system? The public healthcare system across nations is an organized activities that prevent disease such as infections caused due to virus, bacteria, and so on. Now introducing us to the stakeholders of this motion. The stakeholders not only include the government, the ones proposing or opposing this motion, all citizens being the ones that get the healthcare, but also healthcare workers providing the healthcare. For example, the COVID-19 that has been exposed to various healthcare workers and their families at unpredictable levels of risk. Data from many countries across 2 regions indicate that COVID-19 infections among health workers are far greater than those of the general population. While healthcare workers represent less than 3% of the population in large majority of countries, around 14% of COVID cases reported in the WHO are among the healthcare workers. In some countries, the proportion can be as high as 35,000. Thousands of healthcare workers infected with diseases such as COVID-19, Ebola have lost their lives worldwide. Now coming back to our basic duty as citizens, the fundamental duties that are defined as the moral obligations of all citizens to help promote a spirit of patriotism and uphold the unity of India. These duties are set out in the Part 4A of the Constitution, concern individuals and the nation. And over here, in this context, the fundamental duty is a precaution to be aware of our surroundings and not spread diseases. Now, for mitigation of the spread of COVID-19 in the state, the government of Telangana took the following measures of restriction in the movement of people in the state. On March 14, the government ordered the closure of cinema halls, amusement parks, swimming pools, etc., until March 21st, which really extended to March 31st. In the further restriction of movement of people, the state government announced that the lockdown of the state and the country. The lockdown included closing down of state borders, suspension of public transport, and prohibiting congregations of more than 5 people. The law should be publicly disseminated and enforced fairly, which is exactly what our side is doing. When required, independently adjudicating through courts and tribunals. This ensures administration of law helps in this country being a welfare state. And such lockdowns and other restrictions on movement and activities during these outbreak of infectious diseases require community support to be fully effective. During an emergency, it is the legal authority and the roles of the key officials should be defined in law. Laws may authorize powers and authority to take actions that are reasonably required to deal with such serious risks. As, for example, conduct surveillance, treatment, isolation, and quarantine of the affected or potentially infected individuals. As a human being, our health and the health of those we care about is a matter of daily concern. And with that, I conclude by saying that our proposition of the motion is correct, and the House will not provide public healthcare to people who do not take preventive measures to keep themselves safe. And with this, my detail and whip will be finishing this debate, and with these actions and the desirable outcome, and why this proposal side has won this debate. Thank you, and I rest my case and wish my opposition the best of luck.
So may I start with my speech? Yes, cool. Good evening, everyone. The motion today is that this House will not provide public healthcare to people who do not take preventive measures to keep themselves safe. We, Team Telangana, are opposition. This House is voting to explain that how every life matters and how this argument stands wrong, that public healthcare should not be provided to people who don't take preventive measures. Public healthcare is a state subject. The primary responsibility to provide healthcare to all people, despite whatever their background is. Before moving to my first frame, as we all have mentioned about COVID-19, I would start by giving an example of COVID-19 itself. Well, during COVID-19, there were a few people who did not take care of their health and they didn't take preventions for COVID-19. Now, if public healthcare does not cure them, won't they keep spreading COVID-19? COVID-19 wouldn't stop at one place because you're not providing them with vaccines. Henceforth, this argument stands wrong. Well, here's the first claim. If the proposition's motion is set to action, then how will they keep track of people actually following preventive measures? Because as the motion stated, that the ones who don't follow preventive measures, they won't get healthcare. How will you know who did not follow preventive measures? Even nowadays, for fine on helmets, I suppose, there are CCTV cameras. CCTV camera are only installed on main roads. What about others? Because maybe helmets matter more on main roads, but what if there's a person who suppose did not wear mask in his or her colony area, as there are no cameras there? And then suddenly, when he knows there's a camera coming up, she wears a mask. And now he got COVID-19. So the government or public healthcare will consider that, hey, she followed the preventive measures, but actually he did not. This system is totally unfair and not practical. Claim number 2, what measures and on what sectors? As everyone are quite aware that healthcare has different sectors and measures are different too. For example, helmet is a measure to avoid serious injury during accidents. Now, say suppose a person did not wear helmet and sometime he's going for a cancer surgery later. Now, will he not be provided with healthcare just because she did not wear a helmet that one time? Now, claim number 3. What's the point of going for this motion? To save government's economy? Well, if yes, then that's not going to work out. As we all know, people are a resource to a country. A country should know how to make use of them as assets to its economy. Let me take an example to make this clear. Say suppose there's a person who is the only source of income in his or her lower middle class family. Now, due to some reason, that person did not follow some measures and he gets into an accident. He needs urgent health care, but he's not provided with one, and he unfortunately dies. Now, that whole family is in loss. First, they lost someone who was very close to their heart. Second, they don't know how to run their lives without that person. And now that family becomes a liability to the country. Is a person's healthcare seen as a liability on government? Is his or her ability or importance to his or her family not seen? Claim number 4. How do you judge a person not taking measures without knowing the reason? Nowadays, a lot of people are in depression. There can be chances that a person does not follow measures on purpose during some thought process in his mind during that particular time. Wouldn't you give him his or her health care? Even if police put someone in jail after listening to what happened, how can you not provide someone healthcare just after knowing he did not follow that one measure? This even needs to a follow-up and last claim. Such a proposition might say that if we don't provide public healthcare to people who don't follow measures, people will start following preventive measures. But what if it's too late? Will you sacrifice a few people's life in order to make others realize this? With this, I close my case. Thank you.
Speech. With that, let me add the proponent, second speaker. Speaker, are you ready?
Yes, sir.
Okay. On the count of 3, 2, 1.
The first question that might arise is how we will screen out individuals who have taken preventive measures and those who have not, and also the sectors that this preventive measure has been taken, if not, and what healthcare will be provided, which is what the first speaker of the opposition said. The entire healthcare industry is reliant on the efforts of everyone involved. This includes doctors and nurses who are an essential. Our argument proposes that every individual is diagnosed fully and properly, and after the completion of the diagnosis, if their illness is found to be due to their actions and their lifestyles, such as the simple case of lung cancer. Lung cancer can be developed due to multiple reasons, but if the reason after scans, after the immense amount of technology that we have, is found to be because of excessive usage of tobacco, of cigarettes, then it is the individual's fault. It is their moral decision. It is their conscious decision that they have taken that has led to this downfall. But it is important to note that this policy does not mean that people are denied healthcare completely. That would mean total chaos. They are only denied the right to public healthcare. Moving on, we propose that after the diagnosis is complete and a method for cure is found, the fees for those who have not taken preventive measures will be inversely proportional to the severity of their ailment and the amount and different variables that are present. Our policy does not aim at increasing pressure in low-income households or those of backward communities. it aims at increasing the number of healthy and productive individuals in the population. If a family has only one income stream and the person responsible for it is sick, then their fee hike will be lesser than that compared to one whose family has a lot of income stream or has enough finances to fund this cure. Precaution is better than cure. The recent PM Atmanirbhar Swasth Bharat Yojana that was announced in the budget plans in 2022 aims at spending 64,180 crores in the next 6 years towards curative, preventive, and well-being healthcare. This house, the proposition proposes that a minimum of 30 crores be spent on preventive healthcare in the form of well-being centers in all areas, awareness campaigns, and on-field research of the state of precautionary measures that are being taken by different demographics and more. Preventive healthcare has immediate effects on entire communities. Instead of spending a majority of the budget in curative care, preventive care will allow the new and upcoming population to stay healthy and increase wholesome development. The remaining budget is to be spent in curative and well-being healthcare. Increased priority should be given to those ailments that can spread, like viral infections or tuberculosis. This also goes hand in hand with the case study of COVID. If a person has not taken a preventive measure, they must be reprimanded. But that does not mean that they are denied the right to public health care. An estimated 7 million people die of direct tobacco consumption in the form of cigarettes that leads to the development of lung cancer. And this is just not interested. And this is just one of the many ailments that happens. This puts immense pressure on the healthcare services and denies individuals with unpreventable diseases the access of effective healthcare. Priority should be given to those that require assistance immediately. Next up, the proposition believes that the effective implementation of this policy is going to push the population to take care of their health. It is going to push those who don't have healthy lifestyles to be healthier and not be dependent on the public healthcare system to cure them of all their ailments. The sectors in which a person is judged on the basis of which they are judged for when they will be denied or given access to public health care is going to be in an immediate effect. If a person did not wear a helmet in a particular incident and 5 months later they need public health care and have taken preventive measures, we are not going to deny them. It has to be immediate cause and immediate effect, direct correlation and direct causation. We hope that this policy and its subsequent implementation will have an impact on the healthcare system of India and result in a healthier and more productive population. Thank you.
Thank you, Speaker, for your speech.
I'd like to thank the Deputy Prime Minister for that fine speech, and now invite the Deputy Leader of Opposition to continue substantive case beside opposition. Here.
Before I begin, I will take POIs verbally. I will start in 3, 2, 1. The motion today stands that the House would not provide public health care to people who do not take preventive measures to keep themselves safe. We, Team Telangana, are proud to be opposition. But before I continue with my arguments, I will first do rebuttal. So, proposition says that a complete diagnosis would be carried out to find what is going on in a person's body to see if they actually did do the act or not. How do they propose that this will work out in the long run? How long will they rely on this very technology? Then they give the example of an excessive use of tobacco. How many people will you hunt down and see who had the exact reason that you find as the parameter to give them public health care or not? Secondly, they say they give in to our opposition side and say that these people must be reprimanded, but they must be given healthcare, which is exactly what we opposition are saying. They must be reprimanded, but they should be given healthcare. They are giving in to opposition solution. Now, moving on to my constructive arguments. Our first speaker put forth arguments that question the practicality behind proposition's claims and put forth arguments of their own. I'll move on to my constructive arguments now. Before that, I'll define a key term of the motion: healthcare. Healthcare is the efforts made to maintain or restore physical, mental, and emotional well-being, especially by trained and licensed professionals and individuals. We as opposition recognize that there are three stakeholders here throughout this debate: the government, the people, and the healthcare professionals. Now I present my two arguments. Firstly, not giving healthcare to all people excludes many communities and their unique circumstances. Secondly, the second argument, providing healthcare to all people is actually beneficial to the country in the long run. To my first argument. The first argument shows why what proposition said is not the answer. We believe that if we were to give healthcare to people who don't take preventive measures, we would be excluding A, many communities of people, and B, their circumstances. How does this happen? There are thousands, rather millions of people who work under harmful and inhumane conditions every day, 24/7. These people do not have the option. Rather, they do not have the luxury to choose what lifestyle they live. They do not have the choice to save themselves by leaving the factory they work in, let's say. Why? Because
Yeah.
it is the wage they get. Yes.
So you had mentioned that we said that people should be given immediate health care. Over here, this motion specifically states public health care
Can you
and
please
not.
summarize your question?
So I would like to summarize it by saying we mentioned healthcare as in private healthcare for full cost, not public healthcare. Thank you.
That is not what your definition said. It did not cover mental illness, and we will cover that later in our arguments as a third speaker. Continuing with that, will proposition let these people die because they didn't follow the preventive measures? This argument is relevant to the debate because it addresses the biggest stakeholder involved, that is, the people who will be affected most by this harsh policy of propositions. To my final argument, we believe that giving healthcare to all people is actually beneficial to the country in the long run. Why do we say this? Health is the fundamental of all things. What country could the proposition successfully govern whose people are sick and afflicted with ailments? Those people who are the soul and life of the country. How does our proposition how our the opposition's claim come into play? Let me summarize it in a lucid and plain statement. When the government refuses to provide healthcare to people based on just one parameter, they agree to their own downfall. No talks of peace and stability, no strength, nor intelligence can save a country who denies to provide healthcare to such a large majority of its citizens. This argument addresses the people and primarily the center, the second stakeholder here, and is therefore relevant to the debate. But lastly, we not only say that proposition is wrong, we even put forth our plan of model and our solution. Firstly, we propose that doctor and patient ratio be increased by bringing in interns. This will not only increase the doctor ratio but also give the interns a hand-on experience. No, thank you. We propose that governments create schemes and campaigns to deal with problems as soon as they arise rather than letting them escalate. Thirdly, we propose setting up more medical colleges in terms of requirement for faculty, staff, bed strength, and other infrastructure. How do we do this? This is addressed in the fourth and last point. The root problem, mismanagement or insufficient funding. We propose that funds be increased, that the whole idea behind healthcare be implemented, which will ultimately work toward towards making strong citizens who will in turn work towards the success and development of the country. So we, Team Telangana, are proud to be opposition. Thank you.
I'd like to thank the leader of opposition for that very fine speech, and now invite the government whip to conclude the substantive case for side of proposition. Here.
Yes. Okay. So I'd like to receive POIs verbally, and I'd like to start in 3, 2. Okay. So first of all, I'd like to add being the whip. I'd like to spend my first 2 minutes adding and talking about the talking about the good stuff, about our desirable outcome and our desirable action. So what we're saying is that what we're saying is the fact that better health is the fundamental for each society, and the implementation of this particular action, which my previous speaker has told about, will push people to be more healthy while not compensating it. And this includes changing their diet, increasing the amount of exercise done, making changes to the way they live, and moving away from sedentary lifestyles to more active ones, thus boosting the economy related to the previously stated actions by myself, taking a step closer to achieving goals of a welfare state. A healthier person is equivalent to more work being done with more quality, and that particular person will earn more, giving his family a better life, and in general does everything more effectively, leading to development. Firstly, I'd like to talk about what my LO said. How would you, if someone, I mean, like you talked about how, I mean, if someone did it wrong, how would you know, come to realize that? But I think wouldn't diagnosing the patient via technology, scans, and diagnostics reveal that? Because to find a proper cure, you will need to diagnose the patient anyways, because you need to know
POI.
what the problem is. I'd like to answer that a little later. And talking about the next thing, the LO of the opposition said, we're not denying, I mean, you talked about denying healthcare. We're not denying healthcare. We're denying people the public healthcare, which is super cheap and affordable, especially in
POI.
which is more affordable. And we're denying public healthcare at low cost, not healthcare as a whole, because the person needs to learn, and people only learn from their mistakes, and only if that mistake has a subsequent action. I'd like to take that POI, please.
Yes. So you said that proposition does not give healthcare to people, but then a few seconds later you said proposition does give healthcare to people. Please choose one. Which one are you doing? Are you reprimanding them or you're not giving them healthcare?
I think my previous two speakers have cleared this, saying that we're not giving them that particular healthcare, public healthcare, which is really affordable, cheap, or free because of subsidies. But we're in the end charging a little more if they go to government hospitals, or they can choose to go to private hospitals to get proper healthcare. But we're denying them the fact of proper, cheap, affordable public healthcare.
POI.
Yes, please.
Yes. So as you have mentioned, as the previous speaker mentioned of the proposition that you are going to use some technology to know that they have used tobacco or not for that particular lung surgery. What about other sectors of healthcare? Like that's not the only sector that matters, right? What about the other sectors?
I think I clarified that before and my previous people as well. The fact that you will need to diagnose a patient either way to find a proper cure. And when you diagnose a patient, you can tell what he did wrong or what is causing this particular thing. Suppose a person has lung cancer, linking back to tobacco. A doctor can tell via scan that how the lung cancer occurred in the first place and what caused it. So can't you tell that the person's been smoking in that way? And I think that answered your question. And there's a difference between healthcare and public healthcare for the previous POI. And continuing on, I'd like to talk about another point which the LO stated. What if they lose a family member for the patient? I mean, this is not, what we're doing is this can be due to not following the preventive measures in the first place, which caused all of this. Prevention is better than cure. And this is exactly why this law should be enforced. Increase in healthy people, because it will increase the amount of healthy people available in the community. And precaution is better than cure, like I stated. And preventive healthcare will be good example for younger generations, which will lead to a future where largely there's a healthy population who know limits and what to do. Millions die, as my DPM stated, because of tobacco. I mean, if they denied the fact of cheap treatment, wouldn't they realize their mistakes and not go to such an extent and no limits? And we're trying to just push them to be healthier. We're not saying no, but we are saying we're not saying no to public healthcare. I mean, we just say, I mean, like cheap, affordable public. We're saying no to cheap, affordable public healthcare. We're saying an increase in fees, or maybe they can just go to private healthcare centers. But the fact is, if we don't increase the fees, they will never understand. And 10 years
POI.
later, we need to change all of this. Not interested, thank you. And 10 years later, we need to change all of this needs to change. The fact that there's so many patients because of lack of precautions. And I would like to talk. I mean, I think the LO talked about, and the DLO also talked about the mental state of people. But don't you think? I mean, you're saying that the mental state of people justifies what they did not do. I mean, when they did not do something. But I think the mental state of a person is not a justification of wrongdoing, but it is. I mean, mental health care as well. It could be something which needs public health care. But what you're saying is, if a person purposefully does something wrong, I mean, it could be mentally, it could be physically, in any way, it puts others at risk. It puts others at risk. For taking, for example, COVID-19, if you do not take preventive measures, I don't, maybe it's because of a mental condition or whatever, it is putting others at risk. This will all be considered. Maybe you have a mental condition, or maybe you're just doing it because you don't care. This needs to change. You need to know the consequences of what actions you do. And we talked about excluding tons of people from public healthcare. But aren't we helping them change? Because I think the systematic process of screening and all of that will have to happen to find a cure. And that's when we understand what each person has done wrong. And this tons of people who are excluding right now will understand that their mistakes don't get fixed cheap. And in fact, they need to change their ways. And I'd like to also talk about one more point the DLO talked about. How can you govern a country full of people who are sick? We're trying to change that the cause of that. Won't you think doctors are putting their life at risk for that particular point? And on top of that, I think we can't govern a country full of people who are sick. I agree, but then I think the action which needs to be taken towards that is different compared to what the DLO said. We in fact need to change. Need to change the mentality of people. We need to make sure each person knows that their purposeful actions is not cheap, and in fact they need to pay for it, and they need to understand the meaning of it. Why they should understand, right? They might not understand today, but they will eventually understand. And then I'd like to conclude my speech by resting my case and proving my opposition's points irrelevant, thus proving my motion being the proposition correct. Thank you.
I'd like to thank the government whip for that very fine speech, and I invite the opposition whip to conclude the substantive case for side opposition. Here.
Yes, so I'll be starting now. In the count of 1, 2, and 3. Good evening, all. I'll be starting with the rebuttals. The proposition not knowingly agrees with us. They say that they'll provide healthcare to all serious cases. We also said that we'll also provide that. And I'll take all rebuttal of them. They mentioned lung cancer. And let's take example, a person is diagnosed with lung cancer. And when the doctor say that it's because you had tobacco, what is the problem about that? The person was in depression. Then let's consider the person was in depression. Now being pulled deeper into depression, the person was taking tobacco. Now you're sending that person to private healthcare. You're disagreeing that a person cannot receive the public healthcare services, so you have to go to the private ones. Now the private ones charge very, very, very much more than the public ones. So the person might go broke and will be pulled deeper into depression. But instead of doing that, we could just simply provide them health services by public and then send them to the therapist. That will do the same job as doing that the proposition considers. Also, like they will be pulled deeper into depression, which is not good. As taking into consideration that will increase the more the doctor's work. They might not just relieve of tobacco. They'll just go deeper into it. They might become an alcoholic and whatnot. So with this, I'll continue my main content. I'll be taking that later. We strongly agree that the proposition is not keeping everyone's safety in mind and many lives are kept in danger. To prove my statement, let's take a look at points spoken by the proposition. The proposition claims to keep track of everyone who is not following precautionary measures, but the proposition does not specify how. Are they going to keep track of all the people, which makes it difficult for us to understand if the proposition really has looked into the situation from all sides? You mentioned that they will be diagnosed by going into like everyone, but can't people snake, like how are you going to go into the house and pull them out of the house and take them to a hospital? No, people won't just come there with their own wishes. When they're only seriously sick, then only they will come there. Otherwise, like that, this diagnosis is totally not right. And taking the next question, let's take example. There's a person who maintains hygiene and uses all precautionary measures. And he also goes to a public healthcare center. He has missed out a few measures about some precautions. And is the government going to take that into consideration, or is it going to take away that person's right to go into the public healthcare centers for once and all? And let's assume that the person got into a car accident and the government does not allow that to go in the public healthcare center, and the person can't afford a private healthcare center, and due to that lack of treatment dies. What about his family? The government will be the bound to look after his family, and the person will be the first to die of the thousands next. So looking at it from all directions, the government will be lost and many citizens may lose their life. The proposition clearly states that the people that are not taking precaution against diseases are not eligible for public health care. But the reason behind not taking precautionary measures can be the lack of education about diseases. The people of rural areas cannot afford the expensive treatment of private healthcare centers and are dependent on public healthcare centers. Now, there's also the question about rural people. Why are they getting sick? Then this is the point. There are many people that work under harmful and inhuman conditions 24/7. They do not choose these jobs for from their choice, but they choose it because they have to do this for a living. They do this to get their daily wage, which helps them to keep themselves afloat and their families alive. Yes, I'll be taking that later. But how are you saying this that everyone can just go and you're denying them the right to go into the public healthcare centers? How are you just planning to send them all to private healthcare centers? Not everyone can afford those treatments. With this, I conclude that the government is not doing the right thing by taking away the rights of people to go to the public healthcare center just because you do not take certain precautionary methods. Proposition did not provide us a solution or a model or a plan of action. We as opposition had a detailed model and a plan of action, and we gave a logical reasoning for it, which the proposition failed to give. And yes, I'll be taking up one POI. Go ahead.
Does the opposition whip consider an unstable mental state a justification for doing something wrong? Let's take an example. If there's an active shooter who puts hundreds of lives at risk, will you justify that statement and not reprimand them? In the same way, if there has to be a limit to something.
I understood the question. I understood the question. I'll answer that. You are asking about one person that a shooter has put in thousands of people at risk. Can't we look a little deeper into his life? What about he's doing something because of a certain cause? We can't just go that he's shooting people, so he's dangerous, so we'll not provide him health and let him die. And you're saying about sending him to private, like, leave that. We can always try to give people second chances. So why not take him in to treat him and send him into a therapist and then bring him back? He can pay for his causes, but why just not give even them a single chance? Why not? So yes. Yeah, go ahead.
You're on mute.
If nobody has it, then I'll be concluding my speech. Thank you.
Sorry, I just have one more PI.
No.
Okay.
I'd like to thank the opposition whip for that fine speech. With that, I now invite the opposition reply to conclude the case for the opposition bench as a whole. Here.
I'll start in 3, 2, 1. Throughout this debate, we witnessed 3 clashes. Firstly, proposition said that their solution works for all stakeholders, and so did opposition. The reason why we won this clash, or why we won this debate here, I would like to say, is because we gave a detailed plan of action and a model during my speech. It was a 4-step action for those.
Given a detailed plan.
Excuse me?
I'm sorry, please don't interrupt the speaker. Please go ahead.
Could I start again? I don't think that was.
Absolutely. Please notice that while the speaker is speaking, you are not allowed to interrupt or speak out loud. At the time that any person does so, which is not the speaker that's designated to speaking, you will face repercussions. If this continues repeatedly, I will ask the convener to remove you. Please respect the equities of debates. Thank you.
My timer will be restarted, right? So I'm not wrong.
Yes, your timer is going to restart on my sheets. Count me down whenever you're ready to begin.
Yeah, I'll start in 3, 2, 1. So, throughout this debate, we've seen a lot, and I will first start with why opposition side wins this debate. Firstly, our proposition side fails to give a detailed address to people with mental issues. We never said those who are mentally unstable who go shooting people, as proposition puts forth this scenario. We said people who are mentally unstable, who suffer with real life anxiety, depression, and more mental problems like imposter syndrome, etc., etc. These people need to be given public health care, is what we said. We never ever even brought the idea of a shooter. That was something which was completely brought in by opposition, and they do not address it and conveniently put it on us to address, and we did address it. Secondly, proposition did not cover all the stakeholders. The only stakeholders they took was the center and the public healthcare. What about the people who are affected the most, the people? They did not cover it, we did. Thirdly, the reason why we win this debate is because our plan works in the long run. Our plan and our work of solution works in the long run. How does it? With our schemes, with our campaigns, with our idea of medical colleges, etc., etc. This is how we win this debate in the long run. Our clashes. The main clash, to boil it down to one main clash, was that proposition said that this solution will work in the long run and that it is beneficial for the country, as I said, in the long run. And opposition did say the same. The reason why we won this clash was because, again, we had the why, how, and what of how our plan works in the long run. Now, lastly, the reason why the adjudicator should choose us is because we kept in mind the biggest stakeholder, those citizens, the life, the soul of our country, those without whom India, our land is our country is just a piece of land, because the government, the opposition needs to realize that it's not the land that they're governing over, rather it is more than 1 million people. Thank you.
I thank the opposition reply for that very fine speech, and now invite the governor reply to conclude the debate as a whole.
Yes, I shall start my debate in 3, 2, 1. Again and again, we have come to the same ending point. We are in this motion, it clearly states public healthcare and not just mere healthcare. And when we're talking about people who are using tobacco, is it really a valid reason for depression? Over here, how many of us do not suffer depression as children? How many of us have grown out of it without the use of tobacco and illegal substances? And you think that they should be able to give the same ground as people who have taken every preventive measure, even through depression, still not used tobacco and touched even one illegal substance? We have all said that diagnostics are right now one of the best in technological advances and can pinpoint accurately and state what we are doing. Now, people who have gone through a car crash, for example, have not put in a seatbelt, have not checked their car properly. Is it really the fault of the public to not have done this either? They have seen through everything and made a clear deal to put in these preventative measures. And when we come into public healthcare and healthcare are completely different, where healthcare being for individual and public being the overall population. And as our team clearly had logical reasoning, had valid reasons, we stated exactly how our motion, and we took into consideration the fact that doctors are all citizens. We took into consideration the fact that even everybody can get affected due to one minor person. Therefore, our government clearly having the good governance and possessing the norms and knowing what exactly this motion is, enforces law for the good common and equal amount of fairness given to each and every citizen, every stakeholder. Our house upholds the policy of the right to health of each and every citizen by enforcing our motion. Hereby, I conclude this debate by saying why we win. We win because we not only saw each and every citizen, we saw the government, we saw the basic people, we saw the doctors, we saw through everything, and we have come to this conclusion that this motion should be upheld. Thank you, and I rest my case.
I'd like to thank the governor reply for that very fine speech. With that, I bring debate to its natural conclusion. I invite the teams to cross the floor and virtually shake hands. Thank you all for a wonderful debate. I'll take a few minutes to prepare my OA, as well as to confirm the result of this debate, and then I shall begin. First from proposition.
Yes.
And confirmation. Oh yeah, proposition. And can I get confirmation that all teams from opposition?
We're all here.
Sorry, okay, and that's opposition.
Yes.
Is also yeah. Okay.
Yeah, we're all here.
Perfect. All right. Here's how I will go about my OA. Sorry, just 2 seconds. Yeah, sorry about that. My dog likes to eat stuff. That you shouldn't. Yes. Here's how I'll be going about my OA. First, I will give some general comments on debate and how I felt necessarily the debate, what teams could have done better in terms of the round. Then I will give my verdict and why it is that I felt the motion went that way, as well as the general call. Then I'll go into commonly agreed upon stakeholder and what I felt the stakeholder were that was agreed on or decided upon by teams. And then lastly, into the clashes debate. And I'm largely going to do the clashes in terms of a comparison of what we get in different speeches, as well as how that plays out in debate as a whole. All right, starting with some general comments. I felt that teams could have benefited largely from explaining or expanding upon concepts and emotional wavelengths to a whole, to the fullest, which means when a definition or a statement is brought up that a person is likely to feel or act this way, the full relevance of why an actor is likely to operate in that metric and how it's linked to the argumentation of the team as a whole would have been very important in terms of perhaps shifting or changing what the MOV could have been. Secondly, I felt that teams largely failed to engage at times, which often took place in form of, just general rebuttals in the fact that this is not how emotion this works, or we don't necessarily believe that this is going to play out in this way. At the time that you're talking about actors, and these actors are naturally affected by nature of the policy motion that you're debating, it's important to say why there are substantive reasons or causation links, but why this possibly may or may not come true. Lastly, in this House THW motion, I think it's very important to outline what the course of action is that looks like, as what that the House is committing to, as well as potential harms or benefits that accrue. All right, my call is as follows. I believe that the motion falls and that side opposition takes the debate. I believe that was a close to clear margin in terms of my verdict, and I will give speaker scores if you are interested at the end of my OA. Why do I think that's so? First, on the commonly agreed upon stakeholder. I think that the commonly agreed upon stakeholder was the government, both as large as an actor and stakeholder, with the respective stakeholders being the citizens involved, which is fairly conceded to by both teams in respective opening speeches. And I think in terms of people in general, specific sections of the society were highlighted in different manners. With that being said, what did I feel were the clashes that occurred in this debate? First, I think the first clash was on the measure of control, which means how far does the state have the ability to enter into affairs and what is the justification for this? Secondly, I think the next clash that arises with the dignity and value of life. Inherently, what is the value of life in and of itself? And what does that value of life carry in terms of the substantive ability for you to garner rights on that? Thirdly, in terms of actual healthcare, what does it mean for the healthcare industry? What does it mean for the future of what healthcare looks like? And what does that public-private dichotomy exist like? All right. Firstly, in terms of the first clash that we get, I think largely from what we get from government off the bat is that the system, is necessarily geared toward things, and obviously the basic framework in terms of dealing with things like infection, viruses, and bacteria. And I think this is made to layer an argumentation where if you are not necessarily getting sick, then your condition cannot be as valid because of the fact that it's largely something which is to some degree self-inflicted. And I think this type of theme, chronology, runs through government's case as a whole. They furthermore highlight the stakeholders to me, again, government, citizens, even the healthcare workers as well. They point out that they're put at unprecedented risk. They also point out that there's a fundamental duty of citizens that exists, which means that you have things like, necessarily things that you can, alternatives that you can exercise and use and utilize to create a system where you're living to some degree a life that is healthy to a large degree. I think they mentioned sports as well. And they also mentioned that you're essentially not letting yourself go more than other people, at which point they point this is a kind of a comparative chart that exists. And this comparative chart means that there's a baseline that you at least had to abide by. They also clarify roles of doctors and the fact that it's diagnosis and largely the carrying out of, these prospective harms that are there. And I think though, while a large amount of this characterization is good, and I do think it's something which is inherently valid, I think a large portion of the deputy's speech is spent re-impacting this, which points out that we have the system, it fundamentally works, and we carry it forward because of the fact that this holds a principal value. But this principal value is never clearly explained for me, and to what this principal value connotates and why it should be placed above what opposition gives. What does that mean? It means when LO comes and tells me that every life matters and that directly is a state responsibility, that becomes an enormous clash in the sphere of public and private, which means that when government says that we have the private sphere as accessible access that exists anyway, we're not really losing much. I think opposition actually ties this into the state responsibility, even under things like DSPs and basic, articles of the Constitution that exist. Which means to say that if you don't care for patients, essentially this is something which is going to be, a wrong move, and it's going to lead to backlash and different types of issues that's there. They also raise a question very early on about how do you track people who take these type of, substances or may take other things which don't necessarily help them or lack to take preventative measures. And they also point out the fact that there's economic benefit that's immaterial, since the government needs to know how to manage the economy that occurred, the economics of the situation and how it occurs. I think they also delve a little bit into healthcare industry and why necessarily this they make this implicit, and it's not enough for me to credit as much as I like, which could have increased perhaps the MOV or at least the corresponding speaker score. But they do to some degree touch upon the idea of the healthcare industry and flag out to me that this is something which is a lot worse in terms of the private sphere. The reply that I get is that we will have technology be able to assume and assess this, which comes to DPM primarily. To a large degree, we try to flesh this out in terms of proving or trying to showcase this causal action that you'll be able to identify this that occurs. While to some degree, GovFiat does give you ability to say this, I think that what the response that we get from DLO brings a lot of questions toward this situation, which means they say, how exactly do you have this type of reliance, and how essentially are these preventive measures inherently good enough itself? So they make two layers of argumentation. First, you're keeping away from people who affect it and need it the most. At this point, when I combine this with state responsibility, it becomes a welfare argument that you naturally have to reach out to the lowest stakeholder in the situation and seek to uplift them in any way possible. They also point that this right for all means that the sole allies or the individuals who are likely to co-opt or necessarily back behind this movement or back behind the idea of expanding healthcare or making it, equitable, are likely to be disillusioned with this move. I think this is a really good constructive. I think it should have been fleshed out a lot more than what it was presented in, but I think to a large degree it remains unrebutted from government side to it stands, even though it could have been impacted more in the debate. Lastly, they go on mismanagement of funds. Again, I think this attacks against the private-public dichotomy and to some degree highlights a situation like this where an individual, when they access things like the private sphere, are subject to things like, price gouging and other issues that are there, which means this could have been fleshed out more again to make this more of a divisive issue that government has to answer. But I think they do enough to at least pose a question and say, why is the things the way that they are? What do I get then in reply from Governor Wood's speech? I think we get 2 points. A, the idea that you're doing more with better quality, but I find this to be lacking in terms of why this is necessarily true. While I understand that the possible outcomes that may occur in terms of things like downsizing, et cetera, or like this situation that occurs, I don't necessarily have belief about why this is the most likely outcome. And at that point, the benefit of that becomes something which is hard to accredit to your side. Then they go further and say that we're not denying private healthcare, we're denying public healthcare, things like low cost type situations, which means that government welfare subsidies should not be employed for those who fail to take actions to at least utilize their health or keep it within some degree of compete in ability. They say that things like private hospital exist, and they also mention that precaution is better over cure, and that this has an impact in terms of that you need to realize limits and you need to know the consequence of what your actions are. And they also reinforce that they have the tech to know this. Well, I think this is valid, and I think it's a principle hardline stance, but also very fair to run in terms of the fact that people need to know the consequence. I think the problem where the debate becomes slightly clearer for me is what I get from opposition whip speech, which means to say the opposition whip first starts by fleshing out for me that the situation that exists in the paradigm in that current status quo that we're talking about, even within ops world, is going to be a situation where now you have to go into private systems and things like private hospitals to gain any medical attention, which means you're more likely to enter financial difficulty and situation that occurs. I also think they paint a very, very good narrative in pointing out the cycle that exists, which means to say, at the time that you're going to face things like, depression or other mental illnesses that may affect your living ability or your ability to carry on, you may be likely to co-opt and use such substances. Well, I think this is pushed back, especially in reply speech and saying that other people can get over depression, without needing to do substances. I don't think that necessarily proves exclusivity, which means to say, I understand that may be the case, but I also believe that there's a possibility individuals will use substances at times of overcoming things that may occur in everyday life. At that point, I believe there is a stakeholder that's likely to co-opt into this, even if they may not be a regular user. And I think to a large degree, this undercuts a large amount of Gov's argumentation by pointing out this is not a deliberate choice, and very often you may not be in conscious cognizance of what this deliberate choice looks like. They also go and mention things like privacy, where they say that you cannot pull them out of the house, and that basically what you're doing is gatekeeping the fact that you won't allow them to enter, and they can't afford other situations that are there. Which means when the POI comes, which says that will a school shooter or someone with an unstable mental state be considered justified in your paradigm, I think the reply is that when you need to look deeper and dig deeper, I think it points out that, and while it's very implicit, I think the idea, and this is a wonderful response, which really could have been extended, is that necessarily this may be a different type of medical care that they're entitled to. It may not be that they avoid completely things like the rule of law, and I don't think the POI kept them in the position where it seemed like they were shirking that duty, but it's still an investigation into the fact that if this person has long-standing substantial mental illnesses, whether they've undergone things like trauma. And I think that opposition whip does enough to flag this out as a reply, and again gives examples to show why this is likely to be so. Largely in terms of reply speeches, I think reply speeches are fairly decent. I think that, again, in government reply, the only point I would mention is that while the public health care argument is valid, and that equal things are given to each citizen, it doesn't take away from the fact in terms of the fact that people may co-opt to things like substances in the case of mental illnesses. And I think in response to that, I think opposition reply speech in terms of the fact that government stakeholders are limited is very important to note. So at that time, we impacted with the fact that there are individuals who may co-opt this narrative, as well as the idea of the private industry and what this industry means and what this industry quantifies. I believe that opposition takes it. Those are my justifications as such. I will first take questions from proposition, if they have any, and then I will take questions from opposition. Proposition, any questions regarding to the OA? Anything you felt was not considered or not tabulated?
Just one. Haven't we, I think the end of DPM speech and in the whip speech, haven't we, I think, reiterated the fact that this mental condition will be considered to a larger extent, but then again, there's a limit to whatever a person can do.
Yes, while I do think that's said, I think that what opposition does, they attack you with the hard lines of what these examples mean, which means to say at the time that you have first speaker, I think there's a need to impact what this model looks like and what this hard line looks like, which means when they point out that people can enter a slippery slope and essentially co-opt this narrative or use something or not maintain their health or so on and so forth, they point out this mental illness happens in many ways. So I think what you tried to do with the POI and understand the strategy, I think actually strategy was effective, but the response was able to co-opt into that. So when the strategy comes that if someone who is, perhaps shooting up a school or something is someone who falls in this paradigm, what they mention is that you need this type of investigative access and the ability to access these systems to interpret what these true motivations are. So at that point, they mentioned that you need access to this healthcare industry in order to ascertain what this mental state looks like, which means that setting an objective model based on an outward appearance or outward evaluation is likely to affect individuals in a harmful way. At this point, they say these are the most vulnerable stakeholders, and they combine that with the duty of the state and the responsibility of every citizen. So at that point, I believe that outweighs the argumentation that was presented. Any other questions from proposition?
None, sir.
Thank you. Any questions from opposition?
Yes. Could we get personal feedback if that's possible?
Yes, so what I can do is I can, I believe that Kamal is present in the call. I believe that Kamal can perhaps take any note for any speakers who want personal feedback in particular, and then I can send a WhatsApp message that you can forward to each of you individually. What I can do now is I can give the speaker scores if the teams would like to hear that. And yes, would that be something that's suitable to both teams?
Yeah.
Yes, we're fine.
Yeah, I would like speaker notes.
Okay. Yes. My order of speaker scores are as follows, starting with prop bench and then moving to op bench. I believe in prop bench, I gave the Prime Minister 74. I gave the Deputy Prime Minister 74. I gave the Government Whip a 76, and I gave the reply speaker a 36. For opposition, I have given the Leader of Opposition 75. I've given the Deputy Leader of Opposition 76, and I've given the Opposition Whip a 75, with the reply being a 37. Again, to go in prop bench, 74, 74, 76, 36 for reply. For op bench, 75, 76, 75, and 37 for reply. I hope that everyone's able to get that.
Yes, thank you.
I just had a question.
So much. Yes.
How would you say that we make reply speeches impactful, as in tie in our whole side together?
So I believe reply speeches and what I normally said even the last OA is that's largely bias adjudication. So I would think a good start would be to try to draw up what clashes you think are prevalent debate and say, adjudicator, these are clashes by which you objectively view this debate. And within that, you then co-opt pieces of material that were already present and you say, we tell you this, opposition tells you this, and this is what the likely balance and outcome will be, as opposed to more direct rebuttals, which seems like to some degree you're bringing new matter and also doesn't seem comparative in terms of what a reply speech should constitute. Does that make sense?
Yes.
Any further questions at all? Yes, of course. Any further questions? In that case, if not, I'd like to thank both teams. I think it was a very engaging debate. I think that all of you have a very, very bright future in debating. I hope to see you all in tournaments, and I definitely feel like all of you can make a huge impact to both domestic and international. Thank you again, and it was a pleasure to judge your round.
Thank you everyone in the match. Congratulations winning team.
Thank you very
Results
much, sir.
tomorrow. And yeah, even the opposite team, you had the chances to represent and win to ISDS and all. So yeah, thanks a lot, everyone. We'll see you tomorrow at the same time.